Welcome to the Society for Personality and Social Psychology 2021 Presidential Plenary. Please welcome your 2021 SPSP President from the University of Kansas, Dr. Monica Barnett.
Welcome to our first virtual convention and the presidential plenary session of the 2021 SPSP Convention. Nearly a year ago, in what seems like a different time, we met in person in New Orleans, sneaking in our SPSP 2020 convention just prior to widespread shutdowns due to the COVID-19 virus. It's been a difficult and challenging year with social isolation, rising recognition of and reckoning with the evils of systemic racism and social inequality, and the conflict created by a national election in the US. But we're grateful to remain a strong organization that can continue to serve our members through a convention that celebrates our science and connects personality and social psychologists across the globe. Now I'd like to introduce this morning's plenary. I began putting this session together last April, and of course, at that time, the COVID-19 pandemic loomed large. Many of our members pivoted their research and scholarship to issues relevant to COVID-19, and I thought that by February 2021, the pandemic would be over and it would be a good time to review all that we had learned. I was wrong about the timing, but I know that this session will offer some insights from and for social personality psychology about responses and responsibilities in the COVID age. I invited 4 speakers who have conducted research or offered remarks and criticisms about social science and the COVID-19 pandemic. Each speaker will give a brief presentation, which we will then follow up by taking questions from the audience as a group. You can submit questions through the presentations by typing them in the session Q&A in the Whova app. After our final presentation, our panelists will participate in a live question and answer session. Our first panelist is Cass R. Sunstein, who is the Robert Walmsley University Professor at Harvard and founder and director of the Program on Behavioral Economics and Public Policy at Harvard Law School. In 2018, he received the Holberg Prize from the government of Norway, sometimes described as the equivalent of the Nobel Prize for Law and the Humanities. In 2020, the World Health Organization appointed him as chair of its Technical Advisory Group on Behavioral Insights and Sciences for Health. Mr. Sunstein is the author of hundreds of articles and dozens of books, including Nudge, Improving Decisions About Health, Wealth, and Happiness with Richard Thaler, Conformity, and Too Much Information. Please welcome Cass Sunstein for his presentation titled Too Much Information.
Hello, everybody. I'm going to speak about behavior change with particular reference to COVID-19, with particular reference to vaccine uptake. And I'm going to address 3 topics. The first is a general framework for behavior change. The second is the question of vaccine uptake. And the third is the problem of sludge, something that is facing many people all over the world. And I'm going to explore ways to address that problem. The framework has an acronym. It's called FEAST, and it's based on decades of work in behavioral science with reference to psychology and economics and public policy. Some of these ideas will be familiar. It's a summary. The F in the acronym refers to fun, and the basic idea here is that much successful behavioral change is affective. That is, it makes people smile or laugh. And in New Zealand, ways of addressing COVID-19 actually have benefited from the F in the FEAST framework. There's been a laughter and a sense of humor, even in the midst of pretty severe steps that have had to be taken. With respect to combating many health problems, the SMART approaches have been affectively attuned, let's say. And if you can't get quite to fun, at least to get to a positive affect that doesn't have something to do with terror or despair. The E in the FEAST framework refers to easy, And the basic idea here is if you can make a path simple and straightforward rather than complicated and draining, or even better, if you can make it automatic, you can often generate much more of it. With respect to COVID-19, some of the most effective approaches in multiple nations in Europe have used the Olympic gold winner for behavior change, that is the E in the East framework. The word A refers to attractive, and here are some of the early successes in Ireland, which is really struggling right now. But some of the early successes made change attractive and made the instruments of change attractive. A pleasing font, a simple and aesthetically attractive indicator of what it's appropriate to do. The S in the Feast framework refers to social. This wins Olympic silver. And here, it's not just the majority norm that is often helpful in driving change, if people know what the norm is, but also a sense of what is an emerging norm. So the latest work with respect to the power of social norms suggests if there's a dynamic or emerging norm and people are alerted to that fact, it often becomes a self-fulfilling prophecy. An emerging norm can be more powerful than an emerging norm, than a majority norm. The T in the Feast framework refers to timely. Some of the most effective approaches in the United States with respect to health insurance choices and with respect to COVID-19 have been alert to the fact that if you tell people something the night before, that might be like furniture, meaning you don't pay attention to it if things are going in the normal fashion, or like background noise. If you tell it to people right when they're entering, let's say a grocery store or a department store, that's when mask, let's say, alertness can be most effective. And that's when most effective behavior change is likely to occur. The Feast framework is highly generalizable. And with respect to the pervasive problem of vaccine uptake, the Feast framework has actually been applied in a way that's extremely specific. And this is the second part of my remarks. I'm going to talk about a report that the advisory group to the World Health Organization, which I'm privileged to chair, a report which was recently released to the public. Okay, the three problems for vaccine hesitancy are, first, a lack of convenience. Second, complacency. Third, a lack of confidence. And the basic idea is that often when people aren't getting vaccinated is because it's not easy for them. The E in the East framework is not being complied with. Now that suggests that it might not be simple to find where to go. It might not be easy to know what you're supposed to do. It might be that there are forms or waiting times or other things that make the environment anything but enabling. If we think of convenience writ very large, then we might suggest that what is needed is an enabling environment. That is one that is cheap, fast, and kind. An environment that has those three characteristics often in the past has more than dented the problem of vaccine hesitancy, and the more publicized challenges involving, let's say, people who really think vaccines are a very bad idea are often secondary in numbers to the problems caused by a lack of convenience. For the Biden administration in the United States, making convenience kind of job number one is a wise approach. Complacency means a lot of young people in particular think, I'm not going to get sick. And if I'm going to get sick, I've been sick before, it's fine. I'm healthy and I'm strong. There are particular ways to address that, either by signaling that even the strong and the young can be vulnerable, or by signaling that even if the strong and the young aren't themselves vulnerable, if they get COVID-19, the person who dies as a result might be their mother or grandfather. So to use things that people care about, if they are complacent, can be an effective strategy. The third problem of lack of confidence signals the most publicized, which is distrust, a sense that the vaccine is a money-making enterprise. It's been rushed. It can't be deemed reliable. There are side effects. Who knows? Too much ignorance out there, too much risk. A lot of strategies for addressing that are available. The first is use identity protective cognition. And here the basic idea is often people's judgments are a product of them thinking, not what facts am I hearing, but what kind of person thinks what kind of thing. If the source of the message is someone who shares one's identity, it might be demographic, it might be ethnic, it might be religious, that is a way in. The second strategy is health professionals. They are often trusted and credible validators. And if we have trusted and credible validators, they can help meet the problem of a lack of confidence. The three problems, lack of confidence, lack of convenience, and complacency, map on in their own ways to the FEAST framework, and the framework is well adapted to tackling all of those problems. The last thing I want to say a few words about is sludge. And this is a frontiers issue in research and theory as well as in practice. The United States imposes over 11 billion annual hours in paperwork burdens on the American people. Pause over that if you would. That is sludge. Waiting time is sludge. Administrative burdens of multiple kinds are sludge. They operate as a wall, even for fully rational actors, that separate people from things that can make their lives better, whether they are old or young or poor or handicapped in some way, or just busy and struggling with life. A war on sludge has been waged in the past months. It's been kind of quiet and bottom up, with bureaucrats at various levels thinking the opposite of E in the FEAST framework and the opposite of F2 is sludge, and we're going to take some away. So to get certain benefits, you don't have to apply, it's automatic. And to get other benefits, you don't have to interview. And to get other benefits, you don't have to fill out a form. You just have to answer 2 questions. That war on sludge is turning people's lives around. And for boundedly rational actors who, let's say, suffer from present bias or inertia or procrastination, those 11 billion hours can be an act of great cruelty. We need to have sludge audits in institutions all over the United States, and sludge audits typically reveal the level of sludge that we now have is too much sludge. A unifying theme in these remarks about FEAST, about vaccination hesitancy, and about sludge is basically an answer to a single question, which I think has particular poignancy in 2021, which is, what's the most precious thing that human beings have? What's the thing that we are most blessed to possess? That question has many plausible answers. The best, I submit, in this era is indeed a 4-letter word, and the word is time. Let's find ways, shall we, to give our brothers and sisters more of it. Thank you.
Thank you, Cass, for that great presentation. Our next presenter is Dr. Shira Gabriel, an Associate Professor of Psychology at SUNY University at Buffalo. She's a social psychologist and internationally renowned expert on the social nature of the self. Dr. Gabriel just completed her term as co-editor of the SPSP blog, Character and Context, and is the editor of Self and Identity, the primary journal of the International Society for Self and Identity. She studies how social surrogates fill belongingness needs, the relationship of religion to the social self, and the importance of immersion in large crowds for well-being. Please welcome Shira Gabriel for her talk titled Social Contentedness During Times of Social Isolation, Filling the Need to Belong During COVID Quarantine.
The COVID-19 pandemic has brought enormous disruptions to daily life, not the least of which are social distancing rules that make it difficult for people to engage in the kinds of social behaviors that we're used to. Many psychologists have been worried about the negative implications of social distancing guidelines that are incredibly necessary for protecting our physical health, but may not be as good for our psychological health. And we worry about that because humans have a fundamental need to belong. There's a lot of research that suggests that social connections and happiness are closely tied into one another, and that a lack of social connections is one of the strongest predictors of a wide variety of negative outcomes. And in fact, we are seeing some correlational evidence that suggests that these lockdowns are having some negative effects. So we do see, if you plot out COVID cases in the United States in early summer and anxiety and depression, that pretty soon after these increases in social distancing come from increased cases, we do see increased reporting of anxiety and depression. And we see similar patterns happening also in the summer and the late fall. And this is data from the New York Times and from the CDC. In our lab, though, we were interested in whether there are factors that can mitigate this. So is this lower well-being inevitable during social isolation, or can people use non-traditional social bonds? And this is something we've been studying in my lab for the last few decades, is the degree to which people can feel connected to the world around them and to other people through non-traditional means that may be available during times of social isolation. So there are 4 of those I'm going to talk about today. And what I'll do is I'll go through each one relatively quickly and just give you 1 or 2 research examples of it. And then we'll talk about how people during quarantine in our research were able to use these. So the first one is using social worlds that come from narratives. So these narratives could be television shows or movies or books that we read. And in our research, we have looked to see whether engaging with narratives like this can fill the need to belong, can give us a sense of social connection. So this is data from one of the studies that we did, and you can see here that we find what everybody finds, which is that when people's belongingness needs are limited, when they feel lonely and isolated, they have higher negative mood. So this is an experimental manipulation of that. But when we let people think about their favorite TV shows, that completely goes away. So these orange bars here are the favorite TV shows, and the negative mood that comes from this isolation can be, in this particular study, completely went away when people thought about their favorite TV shows. Why do narratives make us feel connected? We have other research that suggests that this is because of something called narrative collective assimilation that we've studied. And so this is when we psychologically become a member of the group collective presented in the narrative, the collective in the narrative. So if you watch The Office, it's not so much that you feel like Jim and Pam are your friends, it's that you feel as if you are working at Dunder Mifflin, as if you're a member of that larger group, that larger community, and it's that sense that makes us feel good. So in some early studies, we primed people, we had them read chapters from Harry Potter or from Twilight in the lab. We gave them identity IITs to measure how much they self-identified as vampires or wizards on a relatively implicit level. And we found pretty big IIT effects where after reading Twilight, people associated self-words with vampires, and after reading Harry Potter, they associated those same words with wizards. And not only did they do that, but the degree to which they did that predicted how much they enjoyed reading the book, what kind of positive mood they were in after reading, and that was mediated by increased life satisfaction. So this is part of the reason why engaging with narratives is so appealing to us. It makes us feel good about our lives because it makes us feel connected on a very deep level to the collectives within that, and as human beings, that's something that we're constantly looking for. We've also looked at how reminders of actual relationship partners can fill the need to belong. One area that we've done a lot of research in is comfort food. And our research finds that comfort foods are the foods that tend to be the ones that we were fed by our primary caregivers as we grew up. Those are foods that Americans at least tend to associate with comfort. And so to the degree that those that we have good associations with those primary caregivers, the food can then make us feel good. the most basic classical conditioning that you could think of. Of course, that would only happen if you have positive associations with those relationships, which most people do, but some people do not. And that's indeed what we found. So these are people who have just gone through a belongingness threat, the kind of people we're worried about in this research. For the insecure people, the comfort foods don't make them feel better. But for people who have a good bond with their primary caregivers, eating these comfort foods make them feel less lonely, even though they're in a situation that would feel lonely. So again, this suggests that reminders of others can function also to fill our need to belong in times when we might not have access to those people. The third area we've looked at are parasocial bonds with celebrities. So these are bonds with people who aren't really in your life, but you feel like they're your friend. One area we looked at this was with former President Donald Trump, and we looked to see if watching The Apprentice predicted having a bond with Trump and then voting for him and liking him. And we ran this study, this series of studies before Trump became president, but after he was elected in 2016. And so we measured how much people watched The Apprentice, and then we measured their attitudes about Trump. And we found that indeed exposure to that Trump media did predict that people liked him more before the election of 2016. And they dismissed the more negative things that they saw about him and really paid attention to the more positive things. And this was completely mediated by these parasocial bonds. So they felt like they knew him, they felt like he was their friend because they had watched him for so many years on TV. And this also predicted actual voting behavior for Trump, self-reported. So these bonds with celebrities can make us feel like they're our real friends, like we really know them. And this isn't just with Trump. We find this, and other labs find this with a large number of celebrities. And so this means that we can get some of the same benefits that we get from real friendship from these parasocial bonds. The final area we've looked at is collective effervescence. This is a feeling of sacredness, ecstasy, and well-being that's experienced when you're with other people and engaged in some sort of common act with them. Durkheim came up with this phrase in 1912, but we've been studying it with a psychological lens for the last 5 or 6 years. And Durkheim looked at this in terms of religious events, but we found that this can happen anytime that people are connected to others, either in person or virtually, and they feel a sense of connection to the other people. So that's one of the two components. And they also feel a sense of transcendence. They feel as if the moment is sort of special. So even though Durkheim thought of this in terms of large events, and a lot of the psychological literature of this very small amount of literature that's looked at it is looked at it in that way, it doesn't have to be a large event. We've had participants tell us they felt this on an elevator with people where something weird happens and everybody sort of feels like they're in it together and like the moment is sort of special, or they're on a bus and something, cool happens and they feel this sense of connection to people and like the moment is special. These things tend to be more common than we originally thought, and they're also very positive. So above and beyond having friends and groups and other kinds of relationships, they predict all kinds of positive outcomes. So our research suggests that people can fill their need to belong through non-traditional means. And more recently, we found that people do, in fact, do this. It isn't just something that we can manipulate in the lab. If you look at what people do in their daily lives, they say on average, they have multiple ways to fill their need to belong, and the mean tends to be around 7. And it doesn't matter how many they have. If you have 2 and those work well for you, that's great. If you have 15 and those work well for you, that's great. What matters is filling your belongingness tank, not how you do it. In addition, when we look specifically at traditional bonds and we compare them to non-traditional bonds, we find that both independently predict all kinds of positive outcomes. And the people who do best actually tend to be the people that have both. So this leads us to the current research where we were interested in whether people use these things during quarantine. So we were in a good position to examine this because we are at a university in New York State, which had very strict quarantine regulations last spring. And we had access to a population where we had happiness and life satisfaction scores from them from before quarantine. In fact, before it was clear that COVID would be an issue at all in the United States. And then during quarantine, so when people in New York State were required to really limit their social interactions last spring, we measured the degree to which participants had collective effervescent experiences. Most of our participants reported these during Zoom or video conferencing kinds of things with friends and family. We also measured social surrogate use, so eating comfort foods, watching TV, reading books. And then we measured how connected they felt generally to see if those predicted connection. We measured overall well-being during COVID. So did those feelings of connection then lead to well-being? And we measured whether people were following the regulations. So did a feeling of connection to others predict staying at home? This is the entire model that we looked at. I'm not going to go through all of this in my limited time, but I will go through the effects I just talked about and the role of extroversion, although we did measure other individual difference variables as well. If you're interested, feel free to send me an email. So these are the indirect effects. And remember, in all of these, we're controlling for pre-COVID levels of happiness and life satisfaction. So we did find that collective effervescent experiences led people to feel connected, or I'm sorry, I shouldn't say it that way. Collective effervescent experiences predicted people feeling connected, and that predicted well-being. It also predicted staying at home. So the more people had these CE experiences, the more likely they were to feel social connections, and the more likely they were to say that they were following COVID regulations. The more likely people had social surrogate use, the higher their well-being. So we see that both kinds of non-traditional connections that we measured, the collective effervescence and then the social surrogate use, which encompass the other kinds that I talked about during the talk, all predicted well-being. So they, as we predicted, using these non-traditional means was related to well-being during COVID. In addition, other labs have found that extroversion, despite what people thought at the beginning of these stay-at-home regulations, that people who are extroverted would have a really hard time. People in other labs were finding surprising effects that extroverts were actually doing fairly well, not as well as before, but relatively well. And our research suggests that one reason for this might be that our extroverts were especially likely to use these non-traditional means. So extroverts were especially likely to have these collective effervescent experiences, which again then led to or predicted a sense of social connection, which predicted staying at home and well-being. Extroversion, extroverts were also particularly likely to use social surrogates, which also predicted well-being. So human beings are highly social, but they also are highly flexible in how they fill those social needs. And so when we as psychologists talk to people about surviving physical isolation from other people, we should talk about, of course, all of the things that we know as a field can help them in terms of exercise and the way that they frame it and reaching out to other people. But we should also emphasize flexibility and finding other ways to connect to others and reducing the guilt that people feel for using these non-traditional means. So allowing, giving people the permission to read books and watch movies and eat their favorite comfort foods without guilt, because even though they feel like indulgences, they are essential for health. Finally, I just want to thank my collaborators on this, without whom none of this would exist. So Elaine Paravati, a former student from my lab, and Isha Naidu, a current PhD student at Buffalo. Thank you.
Shira, thank you for sharing your work with us today. Our next panelist is Jay Van Bavel, who is an associate professor of psychology and neuroscience at New York University, where he directs the Social Identity and Morality Lab. Jay has published in academic journals and written essays for news outlets such as the New York Times, BBC, and the Wall Street Journal. He also co-authors a mentoring column entitled Letters to Young Scientists for Science magazine. From neurons to social networks, Jay's research examines how collective concerns shape the mind, brain, and behavior. This work addresses issues of group identity, social motivation, cooperation, implicit bias, moral judgment and decision-making, and group regulation from a social neuroscience perspective. Jay's talk today is titled Cooperative Science in a Time of Crisis, Using Social and Behavioral Science to Understand a Pandemic. Please welcome Jay Van Bavel.
So, as you know, all of us are living under a very unusual time, one of the most dangerous times, at least in my lifetime, in the last 100 years, as we face this global pandemic. And so what we've been trying to do, in my lab at least, is understand how aspects of polarization and partisanship in the US have impacted the way that we've dealt with this global crisis. And so, as Kurt mentioned, polarization has been growing for many years, many decades, in fact, in terms of what people's beliefs are. They seem to be pulling apart in terms of Democrats are becoming more and more liberal, Republicans more conservative over time. What the research suggests is even more damning is nicely summarized in a recent paper we have led by Eli Finkel and many other colleagues who are experts in polarization. We've noted that over and above this ideological divide, what seems to be more prominent and causing more conflict is an affective divide, where people now find that out-party hate is a stronger force than in-party love and might be one of the most powerful predictors of our voting intentions. So it's not just that you disagree with people, even when you might agree with them or have potential grounds for compromise, you don't want to because you find them aversive or immoral. And so this moralization of political conflict has come with these consequences about how we feel about others. The other thing that seems to be coming with it is a very foundational disagreement on what the facts of reality are. And as Kurt mentioned, this is a challenge because fact checks are not particularly effective, especially in domains of politics. A recent meta-analysis found that it's much less effective than fact checks in all kinds of other domains. And so basic disagreements on facts are incredibly important and dangerous at a moment where facts matter more than normal. So we can disagree about crowd sizes. And in that case, the facts don't really matter so much. But if you're really motivated based on your partisan affiliation or identity to disagree about the risk factors associated with a pandemic that is, in the US alone has killed over 250,000 people, and you're debating whether or not to wear a mask or to distance or go outside, these types of things that reduce risk, or whether or not to have a Thanksgiving dinner at all this year, are foundational issues that scientists have studied. And if we're disagreeing on those basic things, even when there's lots of data on those issues, that presents not only a challenge of agreement, but a life-threatening situation for us. And so this is something that has really marked the way that Americans in particular have dealt with the pandemic. And so I'm going to show you data from surveys from last February to March. And what you can see is that there's big variation within states. So Democrats in Washington and Republicans in Washington both agreed, this was Washington state when the pandemic hit there first, that they were concerned about the coronavirus. But even though they were more concerned, Democrats are more concerned than Democrats from other states, and Republicans are more concerned than Republicans from other states. An even bigger divider was red versus blue. So it didn't matter what state you were from, whether or not there was a single case there yet, you were more concerned than people from every single other Republican state, even if they were facing an outbreak. And so a lot of us realized this might be a problem. This is going to be potentially devastating to people. But around the same time, researchers were using things like Google search and finding that although there's an initial divide in that Democrats are searching more for kind of like hand sanitizer and healthy things, in Republican districts over time, a few weeks, there was a shift where this partisan gap went away and suddenly Republicans seemed just as concerned about hand sanitizer. And so it suggested that maybe this partisan gap was something about how people talk to pollsters or the media, but wasn't reflected in actual behavior. And so, and this is something that happens if there's a distrust of pollsters or media, especially on the right. It's hard to know if they're being direct in some of their beliefs and attitudes. But at the time, I looked at all the data and I thought this is potentially a risky thing because if people don't take this seriously, it can lead to a large number of deaths. And so Anton Gollwitzer, who's a graduate student at Yale University, contacted me when he saw this article I wrote and said, well, we can test this. And he had data from 15 million smartphones moving around per day. And if you have a smartphone, your movement is being tracked. But these were anonymized, so we didn't look at any individuals. But we were able to look within counties and see how humans are moving. And this has really been foundational in this pandemic for tracking the transmission of the virus. As it moved up to other countries and as it spread within countries, movement was foundational to understanding who was put at risk and what we could do to potentially mitigate risks or see where risks were emerging. And so we decided to do this with the smartphone data. And what you can see here is data starting from March 9th and going till right after Memorial Day. And what you can see is that relative to the previous year, on average across the United States, there was increased distancing, such that after a few weeks, by the end of March, people were distancing about 25 to 50% more, depending on how you measured it, than they were the previous year. So people were following the public health guidelines, taking it seriously across the country. What you can also see is as the curve of the pandemic started to flatten in the US, and people maybe got fatigued by this, and the weather got nice, that kind of combination of things reduced social or spatial distancing, such that, you know, by Memorial Day, people were out. They were back to their old behaviors in terms of like traveling. When we looked inside the data, and we compared red states versus blue states, or red counties versus blue counties, across over 3,000 counties, what we found is that there was a stubborn and consistent partisan gap, such that Democrats were engaging, people from Democratic counties were engaging in more distancing than people from Republican counties. And we measured this by looking at how they voted in the last presidential election. So people from Trump voting states were less likely to follow the guidelines about distancing. And you can see little bumps here when you look at reduction of general movement. That's because on weekends, you know, people were more likely to stay home and follow the distancing guidelines. But on average, still during the week, there was this gap. And something that was surprising to me, I thought this gap might close over time as the pandemic spread across the country and people came face to face with it. But if anything, the gap actually got bigger. And so by the end of it, you had an even bigger of the time we looked at it, the partisan gap was even bigger than when we began. And so even as people were becoming more familiar with the pandemic, these patterns of behavior continued to widen in terms of the partisan gap. And this wasn't just that these distancing effects happened, but it had consequences. So we looked a few weeks after each data point to see if it was leading to greater infections, and then even later than that, mortality. And this is exactly what we found. And not only did it lead to more mortality, but it seemed to be grounded in what media people were exposed to. So in counties where people were watching a lot more Fox News, this was associated with lower levels of physical distancing. So partisan media seems to play a role in people's behavior. It's filtering these messages to many millions of people. And then that seems to be predicting this lack of distancing in some counties led to increased COVID-19 infections in those same counties and greater mortality growth rates over time. And so this was done, in the spring. We just published this paper a couple weeks ago. And so this was really, really, to us, concerning findings. This wasn't just people's poll expressions on polls. It was manifest in the real behavior of millions of people that we could measure using these phone movement data. Some people have asked whether this is just conservatives or is it something about the party identification? One way to look at that is to go back to the last epidemic in the US. And what you find there when the Ebola epidemic was occurring was the exact opposite pattern, that Republicans, if anything, were more concerned about the pandemic than Democrats. And so what this suggests to us is it's not something about conservatives per se. It seems to be something about the specific party leadership and communication strategies in this pandemic. So it's something those things are often hard to tease apart, but this historical data gives us some clues. And then now you look 8 months later, and what you can see is that it's really the pandemic massively out of control, largely in red counties. And so you can see that just by looking at this map. It looks almost like an election map. And then here's the hardest hit states. So we found these same patterns in states. Here's what the worst hit states look like right now. As of today, I got this data about an hour ago. And so now you're seeing the massive consequences in the order of tens of thousands and hundreds of thousands of deaths of these gaps. I should say that we measured a number of other variables, economy, population density, a lot of these other things early on people thought might be accounting for why Democrats were taking it more seriously. Now we're seeing the spread in very rural areas, blue collar areas. And so, and our data bears that out. One of the most robust predictors was partisanship. And not only that, it was one of the strongest over and above all these other factors like spatial, how dense a place is, what the economics are, what the employment types are. And so this seems to be a really robust aspect of identity. And then you've seen this manifest in multiple super spreader events hosted by the White House. Here's one at the Supreme Court nomination. When leaders are role modeling and acting like this, it sends signals to members of those parties about what is appropriate risks to take. You've now seen 3 outbreaks in the White House. This was from the Supreme Court nomination. I actually think that the outbreak here probably happened behind the scenes when they had indoor events, because we now know that aerosol is a primary mechanism of transmission of COVID. So if you're gonna do a Thanksgiving event with your family, make sure it's outside. I would not do it inside. And so even if you're together, do it in a way that dramatically minimizes the risks to you. And I also want to say this didn't have to be the case. So I'm Canadian. The data in Canada was suggested that identity could have worked in an opposite way. So in Canada, there was a study analyzing social media messages from Liberals and Conservative party leaders. And in Canada, they all expressed equal concern about the pandemic. And then when they did surveys of Canadians, they found that they, across the political spectrum, were far more concerned. And so when you present a common purpose and a shared identity rallying against a threat, that's something that seems to get rid of these effects of polarization and partisanship, which are also occurring in Canada. And it might have been dramatically life-saving. So even though there is a slight outbreak in Canada right now, it looks nothing at all like the US. It's not rising as quickly. The deaths per capita and hospitalizations per capita are over 100% lower in Canada. So even though there is still an issue in these other countries, it looks nothing like the US.
Thank you, Jay, for those insights. Our final presenter is Dr. Neil A. Lewis, Jr. Dr. Lewis is an assistant professor of communication and social behavior at Cornell University with graduate faculty appointments in communication and psychology. He is a recent recipient of a Rising Star Early Career Award from the Association for Psychological Science. His research examines how people's social contexts and identities influence their motivation to pursue their goals and their success in goal pursuit efforts. Please welcome Dr. Neil Lewis, Jr. for his presentation, Giving Psychology Away.
Hi everyone. I hope that you're safe and healthy wherever you are in the world, and I want to thank you for joining us for this virtual symposium. I want to thank Monica for inviting me to speak as part of this presidential symposium on the pressing topic of how the field of personality and social psychology can respond responsibly in the pandemic age. The topic that inspired the symposium, COVID-19, is new, but the underlying issues that have led us to having this discussion right now are actually quite old. In fact, they go back to the very beginning of the field, and they have resurfaced every few decades since. What I want to do with my time today is talk about the lessons we've learned about intervening responsibly over the years. What are some of the challenges that arise when doing intervention work, and how can we meet those challenges? Before diving into those challenges, we first have to do a quick reflection on how we've typically done research over the past few decades in our field. Reflecting on that process will help to illuminate the challenges that we face when attempting to intervene in the world. So, what is that approach? We often start off with some idea, something in the world that piques our interest, and ideally we do some reading to see what other researchers have done related to this topic. If you're a social psychologist, you then find a way to turn that idea into 2x2 factorial design. A friend of mine noted a few years ago that you can't go more than 5 minutes to a conversation with a social psychologist without them using the phrase 2x2. From there, though, you typically bring in some undergrads into the laboratory to participate in your study for extra credit. You have those undergrads, tap on different keys on the keyboard and record how fast they do it. That's one kind of measure that we use, or often have them respond to some self-report scales. This has been another trend over the past few decades. In recent years, though, maybe you shift from undergrads and have MTechers do those things. And you repeat this process a few times with some slight tweaks so that you get to a full multi-study package that you can send off to JPSB. In that article, you end with a paragraph about how those findings are going to change the world. That has become our sort of recipe for success in social personality psychology over the past few decades. And if we're only speaking to ourselves, maybe that would be fine. The problems come when we try to take the findings from that standard approach and try to apply them to a world that does not fit neatly into our 2x2 models. When you want to apply findings, it requires a different approach. You need to know something about the science of implementation. We need to know how different environments moderate a finding so that we can know where we can apply it and where we can't. We need to know how the attitudes, goals, or identity processes of participants affect their receipt of intervention messages. We need to know something about the dosage and the time course of an intervention. How many times do you need to see the message or hear the message before it kicks in and has an effect? How long will it last? What's the conversion rate between seeing or hearing that message and actually carrying out the intended behavior? We need to know who are the effective agents of change for this to work. Does the message need to come from a doctor, from the government, your barber who's cutting your hair? Does the answer to that depend on which communities we're talking about? These things matter, and they matter a lot. That's a lesson we've learned many times over as we've conducted research in which we've taken things from the lab and taken them to field settings. To quickly share one example, from one recent health messaging field experiment, we tested the efficacy of an HIV prevention message that was designed to be resonant with Black and Brown audiences. In the lab, this message works just fine. Folks pay attention to it. But in the field, what we find is that people are not willing to pay attention to it if other members of the racial in-group are around. They're concerned that they might be judged and stigmatized for watching it. And as a result, they don't pay attention to the message. This is particularly true for Black audiences. I'm sharing this because those kinds of concerns come up in the world outside of the lab, and they matter for when, where, and how we deploy our interventions. And so we have to study and gain a rich understanding of those kinds of factors. How well does psychology understand those factors that are required for successful implementation? That's a question that my graduate student Bharti and I recently asked in a paper we have forthcoming at Perspectives. What we did was we went to the field of implementation science and got a checklist of information that practitioners would need to know to apply findings. When we looked at the past 2 decades of intervention papers published in psychology, we asked the following question: how much of the information that's needed to implement findings is actually reported in our papers? What we found is that there are some things that are pretty much always reported. So people always describe their sample demographics, which is good. And there's some information there about sort of time course and dosage. There are other things that are reported somewhat 50-50, so information about who actually needs to deliver the intervention, it's there about 50% of the time. And there are other things that are pretty much never talked about. So information about what contextual factors moderate the efficacy of the intervention, it's there about 11% of the time. Implementation factors, things like what must be there all the time and what are things that are actually customizable depending on which communities you're talking to. That's talked about 7% of the time. Information about maintenance, how to sustain the intervention effects, about 2% of the time that comes up in the papers. That makes it hard to give our work away, to use our work to address pressing issues in society. If we truly want to give psychology away, to use our knowledge to address the pandemic response and frankly any other issue in society, then we might have to do things differently. We can't continue to with business as usual. That standard approach that I talked about at the beginning of the talk does not produce what Kurt Lewin described 75 years ago as the kind of action research that's ready to serve the public. So if we want to help now, what can we do? That's a question that another group of us asked ourselves last spring and summer as the pandemic was reaching its first peak. So to find some answers, we looked at models and fields that tend to operate in situations where the stakes are high and decisions have life and death consequences. One of the models we found useful for thinking about how to adapt our findings in the world is actually a model that was originally developed by NASA. So in NASA, they strap people on top of rockets, launch them into space, and if they get the science of that wrong, those people die. That's not usually the way we think about psychology research. Normally if you get it right and it's exciting, maybe you get to write an op-ed about it in the New York Times. And if you get it wrong, maybe you've wasted some poor undergrad's time, but no serious harm is done. If we want to intervene in a pandemic, though, lives are at stake. And we have to remember and think about that. At the time I was writing this talk, over 2 million lives around the world had already been lost from this pandemic. lives saved or lost are key dependent variables we have to think about when intervening in a situation like this. So we have to think about things differently and perhaps do things differently when we're working in these life or death situations. We have to partner with stakeholders on the ground to figure out what are the forces that are influencing the behaviors we're trying to change. We have to look and see what evidence we have about those forces, what studies have been done with relevant populations, in relevant contexts, with relevant measures that can be used to inform intervention strategies now. Sometimes there's enough existing information out there that we can draw on. We can get some answers because you can find a situation that's close enough that's been studied. And so you get enough information to act there. But there are other times that it might mean you have to run some new tests to find usable information. Now, some of you may be thinking, Neil, that takes too long. There's no time to do that. We have to get our ideas out right now. And I agree that there is urgency in this situation. But that urgency is precisely why we have to take the time to get it right. Over the past few months, we've seen scientists from across disciplines rush to get papers out the door and into the press because they were convinced that they were right. They had found the right answers to address the pandemic response. Well, at least 63 of those answers that people were so confident about have been retracted since. I'm not saying this to be a downer. I do want us to be there doing whatever we can to help beat this pandemic and to address other social issues. But if we're going to do that, we have to take the time and care that's necessary to get it right. That's how we help. It's how we learn. It's how we improve our theories and broader body of work to make sure that it's ready for the next time something comes along and the world needs our help. That's how we intervene responsibly and use our science to improve the world around us. So those are some things I'd like us to think about as we make decisions about intervening in the world. And with that, I'll stop right there and turn it over to the next speaker. Thank you all.
Thank you so much, Neil, and thank you to all our presenters. Now our panelists will join me to answer questions submitted by our audience members. We'll answer as many questions as time permits.